Well, I had a series of problems with hormones as well as my blood sugar.
I felt uncomfortable and generally didn't feel too well most of the time.
I'm a transplant from Wisconsin, which plays into my dietary habits that got me here in the first place. I actually hadn't been feeling good for about a year, had went to another doctor, and although they did some testing, they didn't do as specific testing as they did here. And I knew I needed to drop some weight. And of course, they have the med spa attached, and of course, they advertise weight loss. So that was part of it, and it's close to home. So I, kind of luck of the draw to some degree, but been very, very happy since I came here.
We tried losing weight and watching what I was doing as far as eating, and it didn't appear to do any good, self-control. And so then they suggested the first-line therapy.
First-line therapy is a phenomenal program that we do here. It's actually a therapeutic lifestyle program. We gear it towards those patients that have diabetes or problems with their blood sugar, their blood pressure, their cholesterol, and it's a full program that where we teach the patients how to eat better. It also does use some medical foods that have nutrients and herbs in it that actually will help blood sugar and cholesterol, and of course our fish oils. And so it's a program really help them to get to their goals without having to use medications.
First-line therapy is all the things that we wish as medical providers that we could be doing but don't have the time ourselves necessarily to do.
We're trying to take an approach to the patient to help them be more well, and we will look for natural nutritional ways to help treat their problems. We'll look at herbs, we'll look at using acupuncture, other types of modalities that aren't just the usual Western medicine, because all of those things can actually play a part in both preventing and treating illness.
It is very, very safe. I've only seen benefits of people doing the program, weight loss, reducing their medications, their insulin, and it's a very safe program, and it's what we all should be doing.
Basically, if a patient comes in and it may be a first-time patient or a follow-up patient and we're reviewing their labs, or we just basically know that they have metabolic syndrome or blood pressure, cholesterol, sugar issues, and obesity around the middle, I always will approach them with conversation about what therapeutic lifestyles could you be doing to make these medical issues better. And then I introduce them to the fact that we actually have a program called First Line Therapy, and that they will be able to actually meet with a health coach every 2 weeks to talk about how they're doing and also set them up on the program.
Honestly, I had a very pessimistic view of it, that I didn't really think I needed a coach. Just give me a diet and I'm on my way. I'll follow it. I'll do fine. That's not really the case, although the program is simple to follow. There have been questions that have come up. There's foods that may not be listed that I like to eat. And Elfie is great because you email her or call her and you've got an answer very quickly, which is good, especially if you want to eat something right away.
First-line therapy, well, you know what? Often it's last chance therapy. Imagine this. A person comes to the doctor and they've been told their cholesterol is high. They've been told that their kidneys aren't working really well, that their sugar is way elevated, and they think, I'm going to die. But really, some really small changes to diet, to exercise, can make such a huge difference, and that's what first-line therapy is.
She evaluated my health with my vital signs and my weight and whatnot, and then gave me counseling on how to eat better, how to exercise better, and take better care of myself.
Alfie told me that it would help regulate my blood sugars and it would help me lose weight, even if I followed the program, and so I did. And yeah, I saw when I went back for my results, the results of from January until yesterday, the results were pretty dramatic.
It was emotional for me. I knew I hadn't been feeling well. I knew I had history, and it kind of was, I was freaked out over diagnoses, concerned about my health. But the big thing was I had to concentrate on me, which is not something I do. And Alfie really kind of listened and took that and worked through it. So it was important.
Some of the rewards are quite amazing, actually. In just a few weeks of following the program carefully, number one, you learn about yourself, but number two, we check your blood work again, and the improvement on the cholesterol numbers, for example, are amazing.
My cholesterol is great. My HDLs and LDLs are doing a lot better. So the results were really, really good.
We've had some patients with diabetes that were previously insulin dependent that don't need to use insulin anymore. We've had patients that have been on 2 or 3 blood pressure medicines that have been able to get away with just one medication. Probably the biggest things that I get excited about is just that they feel so much better, their quality of life is so much better, and I know they're going to live, a long, long time, and I think that patients are just really excited about it.
I lost weight. I felt a little better about my mobility, able to get around, clothes fit better, and general feeling better.
I struggled at first, not so much with the eating, but some of the other medical issues and adjusting to that. But I did eventually get a lot more energy back that I haven't had. I've slept so much better, and just generally feel a lot better. So it's been a little difficult, but not as difficult as I thought it was going to be.
It's amazing, the results. They have increases in their HDL, they have lowering of their triglycerides, some of their inflammatory markers have gone down, they've lost weight, and they're very proud of themselves for those achievements. And again, it's not easy. There's a lot of work that's involved, and but those lifestyle changes are really the key to success.
It takes a steep learning curve at first, but you've got me with you.
Alfie is trained in the First Line Therapy program, and she is there to counsel the patients, to educate them about nutrition.
She is very good at letting you find your way and then supporting you.
You do have to think a little bit about what you eat and what you do, but she gives me coaching along the way all the time, so it always helps to keep things consistent and going forward.
She's extremely warm and friendly, and she's caring, and that comes across in her day to, when she's dealing with me. So, because I can be emotional and I go through my struggles, and she's been there to talk.
She's been specially trained both as a health coach on her own, but then also she did specialized training through Metagenics to be a first-line therapy educator. And she basically runs the show. She meets with the patients every 2 weeks. She's the one that gets them started on their program, continues to encourage them to stick with it, and she basically makes or breaks the success for the patients. She's been doing a phenomenal job for us.
I want people to be able to come to me, talk to me, to be able to say, hey, I'm struggling here.
I just would recommend that that patients recognize that they do have the power to make huge changes in their overall health, and that they feel empowered to do so, and we are more than willing to help them do that.
I think I definitely know it worked for me, mainly because of being able to lose weight, improve my blood pressure and my cholesterol. So if anybody's thinking about it, I definitely recommend it.
Actually, I've had coworkers that have talked to me about what I was doing, and I said, go in and check it out. And they have, and they're now on the program.
I would definitely refer them to Alfie 1,000,000 times over, and just even if they came to talk to her about the program so that they could learn more, because she knows everything when it comes to that. She's really great at explaining it, and she makes it easy. And you kind of walk out of the room like, okay, I can do this, even if you walked in saying there's no way.
We're supposed to be balanced people, but we're living way out of balance. We eat too much, we watch too much TV, we sit down too much, we go out way too much, we drink too many calories, we're way too stressed. And coaching can help change some of that. It doesn't change it all overnight, but we can certainly start making small changes, and every little change helps.
I don't want to be on medication the rest of my life. That's not where I want to be. I can't afford to be. So this is a great approach. It's healthy. I feel good. I'm going to stick with it.